Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Prognostic factors of renal cell carcinoma. So, prognosis. In the prognosis, the single most important prognostic factor is the pathological stage, is the single most important prognostic factor. If there is lymph node involvement is a poor prognostic factor for staging and grading. So, these two are important. For prognostic factor, pathological staging is the single most important prognostic factor, and lymph node involvement is a poor prognostic factor for staging and grading. Now, for the staging and grading, we have two classifications. One, we have TNM classification and Robson's staging are used for renal cell carcinoma. So, for the staging of renal cell carcinoma, we can use two classifications. One, we have TNM Robson's staging. Whereas for grading, this is for staging. Whereas for grading, we can use histological system. That is, Fuhrman's histological system can be used for grading of renal cell carcinoma. Grading is done. See, remember, grading is done by histologically, whether it is well differentiated or moderately differentiated or severely or ill differentiated or undifferentiated and many other grades. So this grading is done by histological system, whereas staging is done by taking into account the tumor node metastasis. So grading of renal cell carcinoma is by Fuhrman's histological system.
thank you and thank you for watching.